Hi. I'm Philip. I am one of the co-founders of Fragmented, and I have the honor to be your stage host for the next couple of hours today here in the TMS track, the healthcare track of the Matrix conference. And I'm really excited to introduce as the first speaker, Patrice. Patrice, thanks for being here. Couple of words about you, if I may. So I checked your blog, I checked your website,
Thank you.
And one thing that sprung to me really, it was you said that the most impactful solutions emerge when we balance innovation with human-centered design.
Yes.
And I couldn't agree more. So I'm really excited that that's your principle. That's what you're what's at the center of your work. Maybe another thing about you, I wrote that that you really like coffee. So bring her
really
a coffee,
do like coffee, yes.
and ask her nicely if she can take you to a private flight because you're doing a pilot license, which I found very interesting as well. So today you will tell us a little bit about how Matrix could be the bridge between European countries and ensuring that we can communicate cross-border. Really excited about your talk. The stage is yours.
Thank you. Thanks, Philip, for the nice introduction. Good afternoon. Board hard. I can do different languages. Guten Tag, guten Nachmittag. Take my take, if you want to do non-human languages. Welcome to our bridge building seminar. We're going to use paper and build bridges. No, we're not. Of course not. We're not. It would be fun, like building our own bridges and testing them out or whatever. But we're here to talk about, of course, at the Matrix conference. So we're going to talk about Matrix and how Matrix can serve as a bridge, not just in one country or another country or at home in your server, but really as a basis for a cross-European, maybe even cross the world, healthcare communication standard. A little bit about me. Philip already started, but I'm going to talk a little bit where I'm from. I'm originally from Germany, live in Vienna based right now. Beautiful city. If you're ever there, let me know. I can introduce you to some really good coffee places. I'm a product leader, international healthcare. I've been with current company, CGM, CompuGroup, we'll talk about that in a second, for 10 years. Across multiple countries. I've led teams across the US, South Africa, a little bit Africa, because we go from South Africa usually up. It's a big continent, there's a lot to do. And of course Europe, like all across. Right now I have teams that work across about 7 countries, and that's just me. I'm technically a VP of software development, so I have a technical background, I have a development background, but I've also done product management, I've done DevOps, whatever. Like, I'm quite versatile. But my focus is always working cross borders, working internationally, not just looking at what's in Germany, what's in France, what's in Switzerland, what's in Austria, but like how can we do this bigger and across multiple countries. Our company, CompuGroup, CGM also called, we are quite a big company. We're about the 3rd biggest healthcare company in the world. There's 2 bigger ones. Both are US companies, Epic and Cerner. But within Europe, we're basically the biggest one. We have offices in about 19 countries, including the US, of course. We're about 60 markets. So you see, we go from, especially, as I said, Africa, but also Asia and whatever. We have sometimes like a hub, and then we go out in the different markets. We have about 8,700 employees worldwide. Changes, we acquire companies. So it changes all the time. We had 9,500 a year before. It just changes sometimes. We have been around for quite a while. The company was founded in 1987. So we have a pretty long-lasting relationship with healthcare. Our founder, basically the first thing he built was a dental system for his wife. She's a dentist. He built a medical system for his wife. That's how we started. And we made last year about 1.15 billion with a B in revenue. Would be nice if that was also the profit that we made. Not quite. It's not 100% profit. That would be cool. I think everybody would love that. But it's a pretty big market. Not as big as the US. Just not gonna lie. Like if you look at the numbers for Epic Cerner, different ball game. But we're pretty unique in what we do in Europe. It's really funny that Philip in the morning, I don't know if you were in that session, already talked about faxes. So yeah, we had fax machines in the 90s. And I think that's what most of us remember. Like, who's still using today a fax machine? Oh, there's one. Okay. So one person probably still works in healthcare. Oh, for voting in the US. Wow. Okay. That is, that is wow. Okay. So fax is fortunately finally disappearing, but in the healthcare sector, everything takes longer. Germany is still talking about it. Austria banned it as of January 1st this year. Officially, unofficially, there's a little grace period until next year. But officially for healthcare, you are not allowed to use faxes anymore. I think the reasons are obvious. I hope so. But you see how long it takes to do that. It's not that we haven't had any other alternatives, right? We had electronic systems early in the 2000s, like the first electronic health records and whatever. France has had one for forever. US has had systems. So we have had alternatives. But what we usually did was we replaced fax with email. Oh, let's do encrypted email for healthcare. Good idea. It's the same thing again. We do have modern approaches like Matrix, but the workflows and everything we're doing is still stuck in the 90s. We'll get to that in a second, like why that is. But it's basically, we're still trying to keep the workflow the same and just replace it with a tool that is basically similar. Can we send the same document, like literally the same document that we sent over fax in the 90s? Oh, let's put that in an email. Oh, let's put that in, I don't know, in worst case, printed out and messages. We can put that also in a matrix, but that's kind of short-sighted if you really think about it. So I always call that, like we went from the Stone Ages to the digital age, but we're in 2025. The digital age is already 25 years old, basically, or a little bit older, actually. So healthcare is behind, always is. The reality is that we have very fragmented healthcare. We have vendor silos. Yes, we're part of that. We have national boundaries. We talked a little bit about already in the other sessions. Like every country, even in Europe, everybody is doing their own thing. We have sometimes regulatory barriers where it's like, even if you're within one country, you need a TI certification in Germany, you need the ALGA certification in Austria, you need the French certification in France. Like everybody is doing their own thing, and if you might still be in that market, but if you don't have that certification, you cannot operate. We have very limited interoperability between the systems. Don't know if you've ever walked into a doctor's office and looked at their computers. They look quite old, right? There's some standards, mostly on the hospital side, but if you go to a doctor's office, like a general practitioner, no standards. Like everybody's doing their own thing. So we're lacking really the global approach to those interoperability topics, and Matrix might be a solution for that. The problem is patients do cross borders. I've lived in Germany. I was born in Germany. I've lived in the US. I'm now in Austria. I had to redo my patient records 3 times, minimum. Because my patient record from Germany did not transfer to US. The US one did not transfer to Austria. Even within Austria, sometimes you move from one place to another and it's like you start over. Does that make sense? I don't think so. So, to come a little bit on what we've built. So we're in the Matrix conference. We've heard already about Fragmented, we've heard about Connect2X. We of course also built a TI messenger, but we didn't just build a TI messenger. We built 2 messengers at once. Because we decided, the whole TI thing is nice, sure, should have it. We're a German company, should have it. But we should have more. So we built a TI messenger and we built a CGM messenger. The difference is literally one works for telematic in Germany and one works everywhere else. Works even in Germany for patients. Like we had a discussion earlier, patients versus insured people. works in Germany for patients. On the left-hand side is our patient portal in Germany that has included or integrated a CGM messenger. So it works. It's there. Now comes the challenge. We have a nice product. We have some really cool use cases we would like to solve with that. One example I think we heard already, coordinating hospital visits between providers and patients, right? You want to stay at a hospital. Hey, when do I show up? What should I bring? All of those questions happen. What medication am I taking? What risks do I have to consent and all of that? We heard about pharmacy consultations if you were in the previous sessions, pretty typical. That happens to me all the time. Medication gets prescribed, not available. Back orders. Nobody knows when it's going to be available. Is there an alternative? Yes. Okay, but now my prescription doesn't work. So what's the typical solution? Pharmacy tells it to me. I have to call my doctor and be like, hey, it's not available. Can you send me a different prescription? And they're like, yeah, sure, we can do that. Wouldn't it be easier to just have if you're lucky, your pharmacy will call your doctor for you? Usually it doesn't. Usually they're like, your problem. So we have shift handovers in hospitals, right? Shift system, 24/7 support, 24/7 care. One shift goes out, they have patients maybe in the ICU. Information needs to be handed over. Information needs to be documented as well. Like the handover usually needs to be documented. So that's a typical thing that you will like to have in a messenger. Why not? And then for sure, ambulatory care coordination. Like pretty typical. It's not just one doctor working with you. There might be a doctor, there might be a physical therapist, there might be a pharmacy involved, there might be a nurse coming to your home, whatever. All of them should coordinate somehow. And hopefully they don't do that over the phone without any documentation. They could, but why? So that's kind of where we stand. The question is, and I think that's why we're here, is this the foundation we need? And I think the answer is yes. It does look perfect, right? It's an open standard, no vendor lock-in. It is, in theory, decentralized. In reality, sometimes. It is interoperable, right? We can work with different operating systems, with different whatever. Doesn't care. Different programming languages, all of that. It has political approval, also important, regulatory approval. For governments, it's super important to say, yeah, this is open. Yes, this is we understand this, we control this. Sure, great. But it was originally designed for consumer use, for little servers everywhere. Has changed a little bit, not saying it is still like that, but that's where it came from. And you see a lot of decisions that to this day haunt us that were made early on when it was okay, everybody is running their own server at home, right? We need enterprise features in healthcare. We have big organizations, hospitals, 20, 30,000 users. They have their own single sign-on. They have their own archiving system. They have 70, 80 different systems that they're running. All of that needs to work together. This is not a small organization. This is really big. And if we talk about an insurance in Germany, 27 million patients, or 27 million insured people, to be precise, right? That's a pretty big organization, and they need enterprise-grade things. Permission systems that work who can access what and who can do what, and what if this person is on vacation or is on sick leave, can I still access their messages and keep the conversation going with another user? All of that. Very hard to do with Matrix. And at the end of the day, Matrix is a protocol, it's not an application. We have applications on top. Tons. But it's not a full solution that you can just say, hey, Matrix, done. Healthcare, problem solved, right? We need more. I get that question all the time. Why not WhatsApp? Why not Signal? Why not Telegram, right? Good question. Every doctor's asking us, I already have WhatsApp, why can't I use it? Centralized control. It doesn't have any healthcare-specific compliance. We have no control about encryption. We have no integration into our primary systems. There's ways to do that with WhatsApp, but forget that. And it is, in some cases, at least closed source. We don't know how WhatsApp works. We have some idea a little bit idea how Signal works, but also limited. Telegram, don't get me started. On the other side, Matrix. It's European, like, I like this word, European digital sovereignty, independence from American, Chinese, whatever, healthcare providers, or not healthcare providers, companies, political parties, whatever you want to name. We have the possibility, we have to start that conversation, we'll get to that in a second. But it is possible to do specific things for healthcare. We started a little bit in Germany already with the TI. There's little extensions to Matrix that they introduced. They only work in Germany, but other topic. We can integrate that quite easily because it's very diverse in technologies that Matrix supports. So we can integrate that into primary systems. And it is fully end-to-end encrypted, which is super important for healthcare. Like, you don't want your healthcare data to be readable by Elon Musk or by whoever, NSA, your neighbor, don't know. And since it's mostly open source, actually almost exclusively open source, there's little things. Anybody can look at it and say, is this well implemented? Is that secure, what we're doing? All of that. The reality looks like that, though. You know, if we were all living in a world with modern cloud web solutions, hey, this is my reality in healthcare. Yes, I have cloud data centers and cloud solutions, but I also have really old computers and old systems, and like we have applications that run only on a desktop, on a client applications, no server involved. We have applications that are classic, like old school client server from the 90s. I think the oldest software I've seen that we have is like 80s. Terminal. We have all of that. Sure, we have also some more modern MacBooks and whatever. On-premise software is great. Like every hospital installs their own software and their own servers and whatever, and then they have their MacBooks access it. Yes, we have to support that. I always make that joke when I have like a technical interview. I'm always like, imagine any programming language, framework, whatever, that was popular in the last 30, 40 years. We probably have a software with that. Because we bought a lot of companies, and everybody came with their own favorite thing. Fortran, not a problem. C#, whatever. Swift would be more modern. It's like, you name it. We have it. Like, so that's the reality. That's what we have to work with in healthcare, and that's what we have to connect with Matrix. Matrix must work across all of them in some way. How we do that is a question. But somehow, if we want to cover healthcare, we will not get everybody to say, hey, great, cloud solutions, everybody upgrades their stuff. It's not going to happen. Not anytime soon. The time frames are sometimes 20, 30 years for a system until it gets replaced. So how did we do that? Because we have a solution for that. We have progressive web apps for the very easy, works in a browser. As long as someone can open a browser on a machine, hey, works. Solutions, right? We have web components for the more modern systems. We're like, okay, you want to have a deeper integration into your system. You're like a web-based, on-premise or cloud, don't care. Web-based, modern, okay, we can do that. Can do some really cool shit. It's not just an API. It's like a whole component with an interface that you can do things with. We have something called a headless client. Funny thing. All those old systems that I'm in, they want to have automations. How do I do that? Matrix is end-to-end encrypted. Classic thing would be, server side, there's an API, I can call something and automate something. Doesn't work. So we built a headless client that you can install, usually on the machine. Could be on a server, don't care. And it has a REST API. And as long as someone can do an HTTP call, they can call it and say, do this, do that, whatever. The solution at the end is, and it's really hard to read on this beamer, but it's a software generational approach. We have all kinds of software generations, and we need different solutions for different generations of our software. The modern stuff is usually actually the easiest. We understand that. It's easy, but we have to go back. Don't have a choice. There's some workflows that users want from us for exactly this automated headless client, for example. Document delivery automatically, like doctor creates a document, prescribes a medication, whatever, gets sent out to the patient automatically. Of course, they want to have the notifications show up in their primary system. They don't want another app that they have to check. Oh, is there a new message? No, they just want it where they usually look. They want to have patients sent, I don't know, patient got a CT scan or got a document from another doctor printed, but or maybe it's digital. They scanned it. Want to send that in, should show up in their primary system. So a message should show up. We have structured document exchange. We do have structured documents, hospitals, fire documents, fire questionnaires, whatever. There is structured medical documents and standards for that worldwide. We want those systems, even if they don't work together because one is Fortran and the other one is C#. We want them to talk to each other and exchange structured documents. And Matrix is perfect for that, if we can make it work. Case-related conversations, I think we talked about already. Get your practitioner, multiple doctors, maybe some specialists all in one chat to talk to each other. But do that in their primary system and not in a separate chat app, right? Do that where their patient record is, right where they have their treatment documents, maybe. So we get to this point. We have a bit of a paradox here. And we have to use, I call it the healthcare usability paradox. Because on one hand, I have a very diverse set of users. They're not the nerds. They're not the people who work with computers all day. We have them. Some doctors, great. They understand. They talk to us on very technical levels. But some don't. Some nurses understand technology well, and the others, if you tell them to open a web browser, they're already lost, right? So it's a very, very diverse set of people. And their focus is usually not to deal with the computer. They're actually complaining to us that they're dealing too much with the computer. They want to treat patients. They want to work with humans. They don't want to deal with the computer all day. Every minute counts as well. Like, we know that, especially in public health care systems. We talk about minutes. Like, how many minutes does a doctor have to treat a patient on average? It's a couple minutes, not much, for an average visit. So, on the other hand, we have, and we know that from Matrix, the whole topic of end-to-end encryption. The stakeholders, if you talk to doctors, Gematik even, like, a lot of people don't understand it. We as vendors struggle to implement it properly in a way that users understand, that also technically works. It's not as easy as it sounds. Spend a lot of time getting encryption to work. Users find it completely confusing. I don't know. You might be the crowd that understands it the best. An average user is lost. Talk to them about encryption keys and passphrases, and they're like, don't know. Regulatory side, they want it. Makes sense, right? And I think we all agree and say, yes, we want data to be end-to-end encrypted. But that means we have to find a solution to that problem. We have to find, and we have some proposals on the Matrix side, we have to find solutions how we can do encryption without losing the user. We also go beyond individual accounts. It's not about you have an account, you have an account, you have an account. We have workflows that are quite complex. It's like, it starts across departments, sometimes across organizations. One doctor talking to another, a hospital talking to another hospital, a department in a hospital talking to another one. We have 24/7 operations, we mentioned that already. We have automated systems, what we use our headless clients for. And we have, and that's really funny, shared workstations. Nurse logs in, nurse logs out. Another nurse logs in, another nurse logs out. Doctor logs in, doctor logs out. If you do device verification and encryption and whatever and setup and do that about 15 million times a day, not going to work. So we need smart solutions there. We're working, usually workflows, multi-device, multi-user, right? Starts on a phone, does something on a desktop, does something on a tablet, maybe an automated system does something. It's quite common in healthcare to have very complex flows that work all in the same patient, the same message, the same case, whatever. So doable in Matrix, but also something you have to think about. Not every user in a system is actually a person. You might have bots, you might have, I don't know, reception desk user. Where there's like 15 people behind it, and depending on who's on shift has that user. It's not always individuals. It's not always, oh, what's your Matrix ID? It doesn't work that way. And then, on top of all of that, we have the regulatory nightmare. I'm saying that not very lightly. We've suffered through it. We heard earlier from Connect to X the same thing. Germany has the telematic infrastructure, has the TIM messenger. Austria has Elga, different thing, has something copied from TIM. France has Mon Espace Santé, MS Santé. Other countries have other solutions. Everybody in the EU and in Europe, and I'm talking very specifically about Europe here because I love the EU, but we're in Europe. People, even if they're not in the EU, people travel even within Europe or move. People from, Switzerland, which is not an EU country, move to Germany or to Austria. So or go on vacation there. Has to work. But unfortunately, currently, everybody does their own thing and everybody says, we're different. Our solution is the better one and our solution is different. Austria does something different. So the last challenge that we have, I call the business model challenge. We're competing with free. Who here has a WhatsApp account? Tons of people. What do you pay for it? 0. Exactly. So if you talk to a doctor, especially small, the big organizations, they're usually okay because they understand it and they're fine with paying some money, not that much, ideally close to 0, but they're okay with paying. The small doctor's offices with like 1 to 5 people, they're like, I have WhatsApp, my patients have WhatsApp, WhatsApp is free, why not, right? We talked about that. So you're always competing with free, which means also it's really hard to get to a price where you say this makes sense from a business perspective. It's a challenge. It's not impossible, but it's a challenge that is quite hard in the healthcare sector because you're convincing people to give away money when you're competing with free. We have very high certification costs. I just mentioned that. If you want to have a messenger in multiple countries, you do that all over and over and over. And I don't remember exactly what it cost us to certify, but I'm going to say it's somewhere a couple €100,000 probably. Just the certification itself, not the product and whatever. Just certification. It's probably around about that. We have, and the last 2 points go together, small provider economics, right? Small offices, 1, 2, 5 users. Don't want to pay for anything, don't need a lot. They just need to chat. Good enough. Versus the really big organizations, hospitals. Charité in Berlin, what was it, 20,000 users, something like that? They're like, hey, we need permission system, we need single sign-on with our own multiple systems, ideally we want, but also German login and whatever, like, we need big things. So you're trying to optimize for the small ones because there's a lot of them, but at the same time, you need to allow for the big ones to still work with you. And that's from a business model perspective also really challenging because you have some baseline costs for just running and operating your application. And you have a doctor with like 3 users who's saying, okay, I'll give you whatever, let's say €3 a month. Just picking a number. Makes it hard to do that. The big ones are usually not that hard. You have more to challenge on the requirement side, but operating is, they have 20,000 users. If every user costs €1, 20,000 euros each month. Okay, we can work with that. So it's really hard to have a business in just messaging if you're working in a single country. And that's the result. And I generated that picture. I don't know, total nonsense, but it's chaos. Digital healthcare chaos. No cross-border communication, no interoperability, duplicate efforts, duplicate standards, duplicate certifications. Like, it's not that Austria is doing a completely different certification. No, they're doing it just slightly different so that you have to redo it. It's impossible for vendors like us to scale because we would like to, of course. We would like to offer a messenger in Europe, but how do you do that? And the patient suffers as well because, as I said, I've moved multiple times. I lose the continuity of my care. I have to start over every time. And at the end, and I specifically said X times the development cost for European countries, because it's not exactly 50, it's actually 53 countries in European area, not EU, European area. But it's not exactly 53 times. Like some of them you might maybe save some money because you're like, okay, it's similar to that, so small changes I can do that. So, but it's still X times the amount I have to spend. So what's the solution? And that's my pitch for today. My vision, our vision is we need a unified European health space based on open standards, of course. That's why we're here. It saves us money. I think that's obvious. If we can do it once for everybody, maybe small things, yes, of course. The French ID, EID we need to support, the Austrian EID we need to support. Okay, sure. Look, if they're all EIDs, yeah, not a problem. We need to support different languages and so on, yes. But we can save money, like shared costs across countries, reduced invest that we can do. We can reduce complexity, right? Right now, if I want to go into another country, I have to increase the complexity of my solution. Because now I have to support whatever Austria needs, plus what the customer wants. Different story. Better care for our patients. I think that's also a good thing. Hey, I can go to vacation somewhere and they can my doctors can talk. Provided they speak both English or have a shared language somehow, but I hope. And I think that's also important, sovereignty from US, sovereignty from China, right? They're dominating the market. They're trying to push into the European market, not lying. Like Cerner, Epic is here. Like some hospitals in Switzerland just signed contracts with them. Well, just last couple of years. They're pushing into our markets. Do we want to be dependent on them? Do we want to be dependent on other countries? Or do we want, as Europe, to stand together and work together? And we can only do that if not every country is doing their own thing. It doesn't work any other way. Because we're competing with very big, very powerful, very rich organizations. And our idea is, I think, the Matrix protocol with some healthcare extensions, and we talked in previous talks a little bit about that, can work that way. We need a little bit more. We need a little bit special things still for healthcare. But I think we have a good baseline. We have the tools available. We just have to get everybody together on it, on one table. So what we really need is coordination. People move, we need to move as well. We need to standardize healthcare extensions. Have what we talked about, the events, the event types. Have the standards in documents that we send, so that we can send a document from a structured medical document from A to B and both sides can understand it. Send a questionnaire, even if it was filled out in France, it still works in Germany. Stuff like that. We really need shared certification processes. Why do I have to redo the certification every time in every country? Does that make sense? I don't think so. And I think that's also a point that gets forgotten, especially from the bigger countries. I live in Austria. Germany has a somewhat easy time to say, oh, whatever, we have about 60 million insured people with 80 million citizens, tens of thousands of doctors, a couple of thousand hospitals. Hey, we can do things. Austria has about 8 million people. Can you imagine how hard it is to build a complex certified thing when you're doing it for maximum 8 million people? It gets really hard for smaller economies to make that make that work, right? Does the Austrian citizen now pay 3 times as much for their messenger just because they're a small country? Does that make sense? Will they do that? I don't think so. So that's kind of also a thing that we have to think about. The smaller countries need maybe to benefit, and that's why a lot of times they copy from the bigger. And if we can look at it from a European standpoint and say, hey, don't care. Everybody can do it. I think we can make that work. Of course, I have to pitch a little bit. Why us? Why do we talk about this? Why do we also think, or why do I actually also think that we're pretty well positioned for this topic? We have the largest European footprint. We are healthcare focused. We're not doing anything else. We're just doing healthcare, which is hard enough in itself. We have about 30 years experience. We have an end-to-end supply chain. We're providing the primary systems, we're providing the messengers, we're providing all kinds of solutions, including ID solutions. We have the European DNA, of course. We're a European company, headquartered in Germany. Working, actually, our core market is still to this day Europe. Pretty wide in Europe, all the way one end to the other. We work in multi-countries. We work across countries all the time. As I said, 7 countries. My teams, 7 countries, not a problem. And we have the relationships to the government. We work all the time. Like, we have certifications all the time. We work with all the governments. We're in all markets. We're trying to get everybody together, and that's the pitch for today. We need that coordination. And we have the expertise, of course. We know Matrix. We work with Element. We have the real deployments. We have the production-ready solutions. We're shipping them right now. So what we need, and I think I would like to get as many of you together if I can, we need a Matrix Foundation healthcare working group. Like we have the public sector one, we need this. We need to standardize the extensions. We need to define how countries will work together. We need to get the cross-border collaboration sped up. We need to work with all the regulatory bodies to say, please don't do a special thing. Please work together. Please, Germany, open up your system so that others can participate and it's not a silo. We need everybody, and we do need the vendors like us. We need the hospitals and the healthcare providers, like the big organizations, the small organizations. We need all the regulatory bodies, European Union included probably, and academic institutions. We always forget that. Academia is quite a big part of healthcare. A lot of research happens there. They have a lot of data that they need, where they would benefit if we had more European data. So they should be part of that. I'm going to leave you with that and say, please come to us, talk to us, I think also use this week to talk to each other and talk to Matrix and join what I call the healthcare bridge builders, because we really need that. With that, thank you for the attention, and I'm open for questions.
Okay, thank you, Patrice. Great talk. I think a very well painted picture of how it could look like if we really work together in Europe. Any questions here from the audience? And I will also remind everyone online that there is the LN Turing Matrix channel that you can join and ask your questions there. I will check them eventually. So you can also write the questions in the chat. But first of all, here in the room, any questions that you have?
Very good.
Nice speech. Thank you
Thank
much. Did I read it correctly on the slide? Do you have web apps?
Yes, we do.
No.
PWA. Yes.
No normal, let's say, Android or iPhones apps. Web apps.
Yes. Yes, with an asterisk, because some of those web apps get embedded in native apps that we already have. So that's a decision, because we're very diverse and we have mobile apps for patients sometimes or for doctors already. So the decision, and they're all, again, different technologies, because we have everything. So the decision was to say, okay, what's the easiest way to do that? What's the most common way to do that? And that was a PWA. So you can run it independently if you want. You could install it even in your home screen. There's a button, Messenger opens it up if you really wanted to. But what most patients and most professionals will do, they will use the app they already have, and in there's a Messenger that opens up. And we have web components and so on for that. So yes. It's a constant, it's a constant discussion, constant fight a little bit. Like, oh, do we do native apps about the stores and whatever? There's never a single answer, and that might change. Like in a year, we might be like, oh, let's build a native app.
Thank you. More questions? Yes.
On the European standardization,
yeah.
So in Germany we have Gematik, in Austria ELGA, and so on. Is there something on the European level that is on the same level as those organizations and that can initiate such a process? Because I'd like to have it very much too, but I think there's much institution lacking on the European level.
They do exist. There is groups, healthcare groups in the EU. It's EU specific, not Europe, but EU specific. They don't have a lot of power because we haven't given them a lot of power. Like, I think we have to be. Yeah. Yes. Probably needs a microphone.
The problem of the European Union is that they are dependent on the nationals, on the national countries. So, and what they try for the moment to figure out where the countries are staying, and what is their current place, and then bring this to a standard together. The interest is there. We have contact here, but it's not a standardized group. And
yeah, and of course the countries are also a little bit fighting against it because they lose some control with it, which we see as a positive thing, but not everybody does. Right? It's politics.
So if the public administration is not making it, or the European Commission, are the industry consortia, the big industries in healthcare, are they already working on this in IATF, W3C, name it, or does it need another standardization body which still needs to be established to work on your questions you brought up?
There's some standardization bodies. So, for example, HL7 is one big one. That's a healthcare standard. HL7 FHIR is what like most countries are implementing these days. But it's global, right? Ideally, yes, we have that on the highest level globally. Everybody works together. Yay! I think politically we're not there. So we work with like those big groups and organizations, of course. But I think there is a need, and I think also potential for having that in Europe. And I'm saying Europe specifically. Yes, I think we need to, and we will have it. It's just a willingness to work together, and we're pushing that forward and saying, let's sit down together, let's figure out how we can do this. We don't have the answers yet, but we're willing to invest and be involved. No. Question back there.
Hi, thanks for the talk. You mentioned that people move across border and therefore have to accommodate different healthcare system.
Yes.
Is there a path in this where people can handle their own medical information? So that either you would have the choice to join your healthcare system infrastructure or bring your own one?
There's solutions for that. Or I wouldn't say super happy with them, but both Apple and Google, for example, are offering solutions for that. And I think that should be, but that is something we have to talk about. Like, for sure, I would like to have me as a patient be in charge of my data, my information, and when I move, I can share it. I can go to a hospital and be like, here's my info that you need. And that's it. But that requires that the infrastructure is there that they can deal with that. And right now it's not. And the solutions from Google and Apple, they mostly work in the US. It's like, they're nowhere to be seen. And whether they're the best solutions, different story. But we're not there yet.
Okay, I think we do have time for one more question. I'm also checking the channel right now. No question there.
Good.
Okay, so then thank you, Patrice. Give her another round of applause. Great talk.